Hello, welcome to my presentation on mental health and coping strategies, presented by Nulu Mr. Oladipo. Mental strain or psychological stress is the result of an emotional response to an outside stimulus, whether positively or negatively. It might affect your own welfare and state of mind, body, and soul. Psychological stress can have a range of causes and substantial effects on people. The following is an overview of some typical causes of psychological stress. Stress in the workplace can be generated by a variety of circumstances, including high expectations, tight deadlines, arguments with coworkers, and job insecurity. Stress from meeting expectations and doing well might harm mental health. Financial instability, debit money worries can stress people and couples. Big payment savings and unexpected bills can create mental stress. Divorces, separation, and strained relationship with families, friends, and partners may be devastating. Unmet trust, communication, or expectation can increase relationship stress. Stress from illness, chronic diseases, or accidents can result from physical symptoms, medical treatment, and uncertainties about the situation. Caring for a sick or disabled loved one can be emotionally exhausting. Even happy life events like union, marriage, childbirth, relocating can bring stress. Changing adding tasks or facing uncertainties can cause anxiety and tiredness. Witnessing or participating in traumatic situations like abuse, tragedies, or violence can have long-term psychological effects. Post-traumatic stress disorder, which causes nightmares, awareness, or recollection may result from such effects. Pressure to adjust to cultural, social, or peer groups norms can generate stress, especially for people who feel excluded or discriminated against. Social media may cause stress by encouraging comparison and inadequacy. Long-term tension and concern may result from seeking perfection in relationship, work, or appearance. An impairing fear of failure or making mistakes can cause people to set unreasonable expectations for themselves. Pollution, noise, congestion, and unsafe neighborhoods can increase stress. Environmental stressor can affect mood, sleep, and quality of life, as well as physical and mental health. Workplace stress can cause burnout, a state of emotional, physical, and mental exhaustion. It may manifest as job insecurity, poor performance, or emotional distancing. Workplace stress may cause anxiety, depression, and heart diseases. Physical and mental health can be greatly affected by financial stress. Drowsiness, insomnia, anxiety, and sadness may intensify. Financially stressed people may eat excessively, abuse drugs, and or skip medical checkups. Relationship tension may harm emotionally and physical health. Conflict or marital dissatisfaction can cause loneliness, low self-esteem, and depression. Relationship stress can induce headache, gastrointestinal issues, and appetite changes. Medical issues can be emotionally taxing and worsen mental illness. Chronic illness or suffering can cause depression, hopelessness, and frustration. Medical diagnosis outlook can sometimes cause anxiety and grief in patients and their families. Even pleasant life transition cause stress and adjustment issues. Beginning a new profession, moving or having children can disrupt routine and cause concern, uncertainties and stress. If mishandled, this change may increase anxiety and depression. Traumatic events can have long-term psychological effects, like having intrusive thoughts, nightmares, flashback, and alertness. Trauma survivor may have problem trusting others along with the avoidance and emotional numbness. Social pressures to conform can lead to inadequacy, self-doubt, and social anxiety. Comparing oneself to others, especially on social media, can worsen self-esteem and discontent. Stress may cause mental diseases and body image issues. Perfectionism encourages individuals to succeed but often produce stress and self-criticism. Persistence in perfection can cause stress, anxiety, and despair. When their unrealistic standards are satisfied, perfectionists may feel inadequate, Pollution, noise and unsafe living conditions can cause harm to mental health. Chronic environmental stress induce irritation and weariness. Living in stressful settings may also increase the risk of depression and anxiety. Practicing deep breathing to soothe the body nervous system and lower stress level, concentrating on taking slow deep breaths, engaging in physical exercise generates endorphins which naturally elevate mood and reduce stress. Mindfulness, yoga and meditation are techniques that help to calm the mind and relieve tension. Putting tasks in order and establishing priorities will help you feel less stressed. For time management, building social support during difficulty circumstances, talking to loved one, a therapist or friends can offer perspective and psychological assistance. You can control your stress level by maintaining a healthy diet, getting adequate sleep and refraining from excessive alcohol and caffeine. Hobbies and relaxation hobbies like reading, gardening or listening to music are examples of enjoyable hobbies that can help relieve stress. Setting boundaries can be decreased and excessive devotion can be avoided by developing the ability to say no. Problem-solving skills help gaining the ability to confront and resolve issues can lessen feeling helpless and give one a greater sense of power. Seeking professional help in certain situations, learning useful coping mechanisms and addressing underlying issues causing stress might involve therapy or counseling. Depending on the structured nature, circumstances, and personal preferences, coping approaches may yield different levels of effectiveness. Nonetheless, the following general evaluation is based on studies and shared experience. Using deep breathing techniques which triggers the body relaxation response is quite efficient for relieving tension instantly. On the other hand, it might not deal with the root causes of stress. Since exercise raises endorphins and lowers cortisol levels, exercising is a highly effective way long-term stress control strategy. Additionally, it enhances general mental and physical wellness. Mindfulness and meditation techniques work well to lower stress level by fostering calmness, raising self-awareness, and enhancing emotional control. Long-term advantages could come from regular practice. Time management is a useful strategy for lowering stress caused by a sense of task overload, though it helps in time management and setting priorities. It might not address the underlying cause of stress. Social support is an excellent source of perspective, practical help, and emotional affirmation. Better stress management and general well-being are associated with strong social relationships. Healthy lifestyle promotes mental and physical health, which effectively lowers stress. Changes might, however, take some time to have an apparent effect on stress level. Passion and calm activities are good for offering immediate stress relaxation and distraction. Regular commitment can improve general well-being but might not deal with the underlying concerns. Setting boundaries works well to lessen the stress brought on by overcommitment and conflicts between people. Although it encourages boldness and self-care, maintaining it could take constant work. Problem-solving skills are good for taking precise aim at pressure and boosting self-assurance. It might not work in every circumstances though, and skills could take some practice. Seeking professional help is a very effective way to deal with underlying psychological difficulties and chronic or serious stress. Therapists are qualified to offer personalized techniques and assistance in effectively managing stress. Thank you for listening.